This video is about refugees and the mental health issues they face. According to the Refugee Convention in 1951, any person who, owing to a well-founded fear of being persecuted for reasons of race, religion, nationality, membership of a particular social group, or political opinion is outside the country of his/her nationality and is unable or owing to such fear is unwilling to avail himself or herself of the protection of that country is a refugee. My country of focus is Australia and particularly Victoria. According to the UNHCR, Australia ranked 46 for hosting refugees with 36,917 refugees up to date and more arriving each year. Victoria typically has the highest intake of refugees in Australia with around 4,000 refugees settling here each year. Now, refugees have many health issues which can either be physical, such as wounds and scars during war or while migrating, or diseases and other illnesses. However, the main reason of concern is their mental health. Many of these refugees suffer from psychological issues resulting from trauma, torture, poverty and deprivation, stay at detention centers, and poor access to healthcare. One of the main issues refugees face is stigma. They are often stigmatized. People make up assumptions about refugees without really educating themselves on what the real issue is. Some of these stigmas can be: they are illiterate, they must have diseases like Ebola or HIV and AIDS, they are most likely criminals or terrorists, they are a cause of unrest in our country, and that they will take over our jobs. Apart from their already traumatic past and the stigma refugees face, factors like language barriers, cultural differences, and environment difference can also affect the mental health of refugees and increase their mental health issues. I will now talk about the effects of stigma. Individuals can be isolated, they can be ostracized by the community, they would avoid seeking medical help, they might not join any intervention or support program in fear of being made fun of by their families or friends. The question now is, how can we help them overcome this fear of stigma? We can provide them with psychoeducation. We can encourage them to talk to someone, especially a medical or health professional. It is important to remember that some of them may not be familiar with the English language, and interpreters should be available to them at all times. We can encourage them to join support groups that are specific for refugees. We can have a social worker visit their homes, or we can provide them with medication. I have listed down some refugee support programs being run in Victoria. The Refugee Health Program, the Refugee Health Fellows Program, the Victorian Foundation for Survivors of Torture, the Multicultural Help and Support Service. All these support programs may directly or indirectly help refugees with mental health issues and provide them with support they need. Thank you for watching.